1. What is the priority nursing intervention for a postoperative patient showing signs of hypovolemic shock? Answer. Initiate fluid resuscitation and notify the healthcare provider. Rationale. Hypovolemic shock post-surgery, indicated by tachycardia and hypotension, requires immediate fluid resuscitation to restore volume. Notifying the provider ensures rapid intervention, per AHA shock management guidelines. 2. What should the nurse teach a patient with heart failure about managing fluid retention? Answer. Monitor daily weight and report a gain of 2 to 3 pounds in 24 hours. Rationale. Sudden weight gain in heart failure indicates fluid retention, risking pulmonary edema. Daily monitoring allows early intervention, per AHA heart failure guidelines. 3. What is the nurse's first action for a patient with a blood glucose of 350 milligrams per deciliter? Answer. Administer prescribed insulin and monitor for dehydration. Rationale. Hyperglycemia requires insulin to lower glucose levels and hydration to prevent complications like diabetic ketoacidosis, per ADA diabetes guidelines. 4. What should the nurse assess in a patient with suspected pulmonary edema? Answer. Assess for crackles and shortness of breath. Rationale. Pulmonary edema causes fluid in the alveoli, leading to crackles and dyspnea. Assessment guides oxygen and diuretic therapy, per AHA heart failure guidelines. 5. What is the priority nursing action for a patient with a potassium level of 6.0 milliequivalent/L? Answer. Administer prescribed insulin and glucose and notify the provider. Rationale. Hyperkalemia, greater than 5.0 milliequivalent/L, risks cardiac arrhythmias. Insulin/glucose shifts potassium into cells, and notification ensures further treatment, per AHA electrolyte guidelines. 6. What should the nurse include in discharge teaching for a patient with a new colostomy? Answer. Teach to change the appliance every 3 to 7 days and monitor skin integrity. Rationale. Regular appliance changes prevent leakage and skin breakdown. Monitoring ensures early detection of irritation, per wound, ostomy, and continence nurses society guidelines. 7. What is the nurse's first action for a patient with chest pain and suspected myocardial infarction? Answer. Administer oxygen and obtain a 12-lead ECG. Rationale. Chest pain may indicate myocardial ischemia. Oxygen improves tissue perfusion, and an ECG confirms infarction, per AHA acute coronary syndrome guidelines. 8. What should the nurse monitor in a patient receiving furosemide for heart failure? Answer. Monitor for hypokalemia and dehydration. Rationale. Furosemide causes potassium and fluid loss, risking arrhythmias and hypotension. Monitoring ensures safety, per AHA diuretic guidelines. 9. What is the priority nursing intervention for a patient with a new onset of confusion in sepsis? Answer. Assess vital signs and administer prescribed antibiotics. Rationale. Confusion in sepsis may indicate cerebral hypoperfusion. Vital signs guide fluid therapy, and antibiotics treat infection, per surviving sepsis campaign guidelines. 10. What should the nurse teach a patient about preventing falls after hip surgery? Answer. Use assistive devices and remove home hazards. Rationale. Hip surgery impairs mobility, increasing fall risk. Assistive devices and a safe environment promote safety, per the Joint Commission Fall Prevention Guidelines. 11. What is the nurse's first action for a patient with a hemoglobin of 7G/DL post-surgery? Answer. Prepare for blood transfusion as prescribed. Rationale. Severe anemia, 8G/DL, causes hypoxia. Transfusion restores oxygen carrying capacity, per hematology standards. 12. What should the nurse assess in a patient with suspected acute renal failure? Answer. Assess urine output and fluid status. Rationale. Acute renal failure reduces urine output, causing fluid overload. Assessment guides fluid management, per NKF guidelines. 13. What is the priority nursing action for a patient with a new onset of shortness of breath in COPD? Answer. Administer prescribed bronchodilators and oxygen. Rationale. Shortness of breath in COPD indicates bronchoconstriction. Bronchodilators and oxygen improve airflow, per GOLD guidelines. 14. What should the nurse include in teaching for a patient starting warfarin? Answer. Report signs of bleeding and maintain consistent vitamin K intake. Rationale. Warfarin increases bleeding risk. Consistent vitamin K prevents INR fluctuations per AHA anticoagulation guidelines. 15. What is the nurse's first action for a patient with a new onset of abdominal pain post-appendectomy? Answer. Assess pain characteristics and notify the provider. Rationale. Abdominal pain may indicate complications like abscess. Assessment and notification ensure timely diagnosis per surgical care standards. 16. What should the nurse monitor in a patient receiving for heparin? Answer. Monitor for bleeding and APTT levels. Rationale. Heparin increases bleeding risk and requires APTT monitoring to ensure therapeutic levels per AHA anticoagulation guidelines. 17. What is the priority nursing action for a patient with a sodium level of 125 milliequivalent/L? Answer. Notify the provider and restrict free water intake. Rationale. Hyponatremia, less than 135 milliequivalent/L, risk seizures. Restricting water and provider notification prevent worsening per clinical electrolyte standards. 18. What should the nurse assess in a patient with suspected gastrointestinal bleeding? Answer. Assess for melena and vital signs. Rationale. Gastrointestinal bleeding causes melena and hypovolemia. Assessment guides fluid resuscitation per American College of Gastroenterology guidelines. 19. What is the nurse's first action for a patient with a new onset of leg swelling post-surgery? Answer. Assess for deep vein thrombosis and notify the provider. Rationale. Leg swelling may indicate DVT, a post-surgical complication. Assessment and notification ensure rapid diagnosis per the Joint Commission guidelines. 20. What should the nurse teach a patient about managing hypertension? Answer. Limit sodium intake and adhere to prescribed medications. Rationale. Sodium restriction and medication adherence reduce blood pressure, preventing complications, per AHA hypertension guidelines. 21. What is the priority nursing action for a patient with a new onset of seizures post-craniotomy? Answer. Administer prescribed anticonvulsants and ensure safety. Rationale. Seizures risk injury. Anticonvulsants and safety measures prevent harm, per ANS neurosurgery guidelines. 22. What should the nurse monitor in a patient receiving total parenteral nutrition? Answer. Monitor for hyperglycemia and infection. Rationale. TPN increases glucose and infection risks at the catheter site. Monitoring ensures safety, per Aspen nutrition guidelines. 23. What is the nurse's first action for a patient with a new onset of fever post-surgery? Answer. Obtain blood cultures and notify the provider. Rationale. Fever may indicate surgical site infection or sepsis. Cultures and notification ensure timely antibiotics per CDC infection control guidelines. 24. What should the nurse assess in a patient with suspected pancreatitis? Answer. Assess for epigastric pain and nausea. Rationale. Pancreatitis causes severe abdominal pain and nausea due to inflammation. Assessment guides pain management per American College of Gastroenterology guidelines. 25. What is the priority nursing action for a patient with a calcium level of 12 milligrams per deciliter? Answer. Encourage fluid intake and administer prescribed diuretics. Rationale. Hypercalcemia, greater than 10.5 milligrams per deciliter, risks renal damage. Hydration and diuretics promote excretion, per clinical electrolyte standards. 26. What should the nurse include in teaching for a patient with a new tracheostomy? Answer. Clean the site daily with saline and report signs of infection. Rationale. Daily cleaning prevents infection, and reporting symptoms ensures early intervention, per American Association for Respiratory Care guidelines. 27. What is the nurse's first action for a patient with a new onset of chest pain and heart failure? Answer. Administer prescribed nitroglycerin and notify the provider. Rationale. Chest pain may indicate ischemia. Nitroglycerin relieves angina and notification ensures evaluation, per AHA heart failure guidelines. 28. What should the nurse monitor in a patient receiving prednisone for COPD exacerbation? Answer: monitor for hyperglycemia and infection. Rationale: prednisone causes elevated glucose and immunosuppression. Monitoring prevents complications, per GOLD guidelines. 29. What is the priority nursing action for a patient with a new onset of confusion in hepatic encephalopathy? Answer: administer prescribed lactulose and notify the provider. Rationale: confusion indicates ammonia buildup. Lactulose reduces ammonia and notification ensures further treatment, per AASLD guidelines. 30. What should the nurse teach a patient about preventing pressure ulcers post-spinal surgery? Answer: reposition every 2 hours and use pressure-relieving devices. Rationale: immobility increases ulcer risk. Repositioning and devices reduce pressure, per National Pressure Injury Advisory Panel guidelines. 31. What is the nurse's first action for a patient with a new onset of shortness of breath post-thoracotomy? Answer: assess respiratory status and notify the provider. Rationale: shortness of breath may indicate pneumothorax. Assessment and notification ensure rapid diagnosis, per American Thoracic Society guidelines. 32. What should the nurse assess in a patient with suspected diverticulitis? Answer: assess for left lower quadrant pain and fever. Rationale: diverticulitis causes inflammation, leading to pain and fever. Assessment guides antibiotic therapy, per American College of Gastroenterology guidelines. 33. What is the priority nursing action for a patient with a magnesium level of 1.2 milliequivalent/L? Answer: administer prescribed magnesium sulfate and monitor for arrhythmias. Rationale: hypomagnesemia, less than 1.7 milliequivalent/L, risks cardiac instability. Magnesium and monitoring prevent complications, per clinical electrolyte standards. 34. What should the nurse include in teaching for a patient starting insulin therapy? Answer: rotate injection sites and monitor for hypoglycemia. Rationale: rotation prevents lipodystrophy and monitoring detects low glucose, per ADA diabetes guidelines. 35. What is the nurse's first action for a patient with a new onset of hematuria post-cystoscopy? Answer: assess urine output and notify the provider. Rationale: hematuria may indicate bladder trauma. Assessment and notification ensure timely evaluation, per AUA guidelines. 36. What should the nurse monitor in a patient receiving digoxin for heart failure? Answer: monitor for toxicity and heart rate. Rationale: digoxin has a narrow therapeutic range, risking toxicity. Monitoring prevents arrhythmias, per AHA heart failure guidelines. 37. What is the priority nursing action for a patient with a new onset of fever in acute renal failure? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever may indicate infection, common in renal failure. Cultures and antibiotics prevent sepsis, per NKF guidelines. 38. What should the nurse assess in a patient with suspected stroke? Answer: assess for facial droop and speech changes. Rationale: stroke causes neurological deficits like facial droop and dysarthria. Assessment guides thrombolytic therapy, per AHA stroke guidelines. 39. What is the nurse's first action for a patient with a new onset of pain at a surgical incision site? Answer: assess the wound and notify the provider. Rationale: pain may indicate infection or dehiscence. Assessment and notification ensure timely intervention, per CDC infection control guidelines. 40. What should the nurse teach a patient about managing chronic renal failure? Answer: restrict fluid and monitor for edema. Rationale: renal failure impairs fluid excretion, causing edema. Restriction and monitoring prevent overload, per NKF guidelines.